know, my name is Anita Langston, and I'll be your NP for today. And I am a student at the University of Memphis, Fall 2025. And I'll be performing your comprehensive head-to-toe assessment. Okay, could you please state your name?
Kiana Rhodes.
Okay, and your birthday?
July 27, 1989.
Okay, do you know what city we in?
Memphis.
And do you know the reason why you're here today?
For my assessment.
Okay. Miss Tiana is alert and oriented ×4. She's able to verbalize her name and her birthday. She's able to state the city, and she's appears to be, her mood is calm and pleasant, and her skin tone is appropriate for her ethnicity. Okay, are you in any pain or discomfort?
No, ma'am.
Okay, so now I'm going to provide privacy. I'm going to perform hand hygiene. And now the assessment can begin. First, I'm going to start with your hair and your face. Her face, like I said, her face, she is midline. Just look straight at me, okay? It's midline. It does not deviate to the right or left. She has no facial drooping on either side. Her eyes or sclera is white. Her conjunctiva is clear. And her eyebrows and eyelashes, hair is distributed appropriately among the eyebrows and eyelashes. Her hair is distributed evenly over her hair. And so now I'm going to come around because I'm going to palpate your scalp. And as I palpate, what I'm doing, I'm feeling for any contusions, lumps, and I don't feel any. And also I'm going to look at the occipital area, and I see no nits or infestations. Her hair is clean, and she is well groomed. Her hair is long, curly, and coarse, and that is appropriate for her ethnicity. All right. Next, I'm going to feel for your skin, for your body temperature, and I'm going to start at your face. I'm going to make my way down your body. Okay. Your hands. Okay, now your legs. Okay, and as I make my way down to her legs, I'm also going to notice if she has an edema and which she doesn't. If she did have edema, then I will palpate for non-pitting or pitting edema. Okay, next I'm going to check for your skin tinting, and that is checking to see if you are hydrated. And what I needed for your skin to do immediate recoil. Okay. And you do have immediate recoil, and that means that you are well hydrated. Okay, next I'm going to start with your eyes. And this will be optic nerve 2, cranial nerve 2, which is the optic nerve. Excuse me. And I'm going to use the Snelling chart to check your cranial nerve. Okay, I'm going to hold the sign 14 inches from your face. And what I want you to do is to identify the last line, but I want you to cover one eye, and I want you to call out the last line.
LTFPH.
Okay, then I want you to cover the other eye, but I want you to gather your vision first, and I want you to read the same line, but I want you to read it backwards.
HPFTL.
Okay. Patient has 20/20 vision according to the Snelling chart. And now I'm going to look at your pupil to do your pupil gauge, according to the Snelling chart. And could you open your eyes for me? Okay, just look straight at me. There you go. And then it's 3 mm on each side bilateral, and it could be 3 to 5, meaning they're normal. Okay, next I'm going to check. I want you to look at my finger, and I want you to follow my finger into your nose with your eyes. Do not move your head. All right. And then the next we're going to check is your peripheral. I want you to look, and what I be performing is an H. Don't move your head. I want you to follow with your eyes. And this is checking your field of gaze. And you do have perfect field of gaze in all fields. Next, I'm going to check for direct and consensual. Now, with the direct and consensual, when I shine the light in this eye, then this eye will have consensual because it will also constrict, and that is what I'm looking for. Just look at it. Okay, just look straight at me. All right, and consensual. Okay. Both eyes, you okay?
Mm-hmm.
All right. Consensual and they direct, and then pupillary reflex is positive. Okay, next I'm gonna check for your red reflex. And I just want you to pick a spot on the wall. Just look straight behind me.
Oh,
Mm-mm.
oh. Okay.
All right. And I just want you to pick a spot on the wall. And what I'm doing, I'm checking to make sure you do not have any cataracts. Oh, my glasses. Okay. Okay, good. I have positive red reflex. Okay, and when your eyes constrict and they converge, and that is normal, so you have a positive perla. Your pupils are equal, active, and react in accommodation. All right, the next I'm going to check your ears, and on the inspection of your ears, they're normal and they're sitting on each side bilaterally symmetrical on each side of your head. I don't see any oxidate. They're clean. I don't see any drainage. I do not see any lesions or any skin disruption. So now I'm going to look in your ear. Change my otoscope. Okay, and what I'm checking here is to make sure that your tympanic membrane is clear. Okay, you just hold your head still.
Okay.
All right. And just lean toward me. And then this will be up and back. Okay, tympanic membrane is clear and pearly gray, and I see no obstruction. Okay, I'm gonna check on this side. Up and back. At 7 o'clock, tympanic membrane is clear, no oxidate, and I visualize no impaction. Okay, the next I'm going to look in your nose. And what I'm looking for in your nose to make sure that your nasal passages are clear and you have no oxidating it. So I just want you to hold your head up. And I'm going to, okay. I see no oxidate. Your nasal passages are clear. Your septum is midline as it should be, and that's normal. Okay, next we're going to do the smell test. And what I want you to do is to close your eyes. And when I take this across your nose, I want you to identify your smell. Okay?
Rubbing alcohol.
This. Okay. Thank you. And patient is able to correctly identify her smell. Next, smell. I want you to close one nostril at a time and take a whiff. Okay, and the other side. Okay, and then that shows that your nasal passages are clear. All right, and then now I'm going to do the mouth. Okay, on inspection of the mouth, her lips are pink. I see no facial drooping on each facial drooping or deviation to the right or the left. I'm going to ask you to open your mouth and hold your head back and stick out your tongue. She's pink and moist. Hold your tongue up. Salivary glands. Oh, very good. Put your tongue back down. And now I want you to say, ah.
Ah.
Okay, the tongue sits midline and the uvula rises on phonation. Okay. So now I'm gonna check your sinuses. I want you to look at me, and I want you to tell me if you feel any tenderness or pressure. You feel any tenderness?
No.
Okay. Side of the nose, you feel any tenderness?
No.
All right. And under your eyes, you feel any tenderness?
No.
And your sinuses are clear. And next, I'm gonna check your lymph nodes. All right. So we got pre-auricular, any tenderness?
No.
Okay. Post-auricular, any tenderness?
No.
Okay. Tonsillar, any tenderness?
No, ma'am.
Submandible, any tenderness?
No, ma'am.
Okay, and I want you to lower your tongue in the base of your mouth. Okay, submental, any tenderness?
Mm-mm.
All right, so now I want the anterior cervical, any tenderness?
No.
Okay. Post-cervical,
No.
any tenderness?
No, ma'am.
Okay. Occipital, just bow your head just a little bit. And the tenderness?
No, ma'am.
Okay. And just relax your shoulders. And the tenderness?
No.
Okay. Our lymph nodes, patient has voice non-tender and no problems noted. The next I'm going to check your carotid artery. And I'm checking it one at a time. Okay, 2+ pulses, and I want you to stretch your arms out. I'm checking your, just let your hands relax. Brachial. Radial. Popliteal. Posterior tibula. A little hard with the socks on, but And then normally, if you didn't have your shoes on, I would check your dorsal pedialis.
Do you need me to take them off?
No. So now I'm going to check your breath signs. And I'm going to start with the posterior chest. You just sit still. And as I make my way around, I see that her AP is normal 2 to 1. And I forgot your thyroid gland. So let me make my way back around, and I'm gonna check your thyroid gland. Then I check you. Okay, with your thyroid gland, I'm going to, and I want you to turn your head. In the tenderness. Okay, and then come back on the side, same thing. In the tenderness.
No.
Okay. Then I'm gonna come behind you. I'm not gonna choke you. We'll go find the base of your neck. Just hold your head up a little bit. There we go. And this is your trachea. Okay, I just want you to take a swallow for me. Okay. Patient voice, no tenderness, and her thyroid was palatable when she swallowed. Okay, this I'm gonna check for fremitus and resonant. All right, just relax your shoulders for me. And then I'm going to ask you to just take a deep breath. But at any time if you feel dizzy, just let me know and we can stop. Okay, take a deep breath. Okay, let it out. Relax. Okay. And fold your arms and just lean just a little bit, and that's making it wide so I can see your spine and get between the intercostal spaces and not check on your scapula. Okay, take a deep breath. Okay, breathe. Take a deep breath. All right, breathe. Take a deep breath. Breathe. All right, take a deep breath. Breathe. Okay, and breathe. So now when I place my stethoscope, I want you to say 99.
99. 99. 99.
Okay, and next I want you to say E.
E. E. E.
Okay, and on the next I want you to whisper 1, 2, 3. Okay. Sound is resonant. And I hear no consolidation. Next, I'm going to check base of the ribs. Come up to the 10th intercostal space. All right, just relax. And so whenever you breathe, I want you to take a breath in, and I'm checking for symmetry. Okay, and my hands did rise symmetrically upon, you can breathe, inhalation. Now I'm going to check breath sounds on the front. jury around. Okay, take a deep breath. Okay, exhale. Take a deep breath. Exhale. Take a deep breath. Exhale. Take a deep breath. Exhale. Okay, now when I touch, I want you to say 99.
99. 99. 99. 99.
Okay, resonant sound is heard throughout lung fields. Okay, now I want to check your heart rate. Okay, just be still. And this is your aorta, right of the sternum border. Second intercostal space. Pulmonic, left of the sternum border, second intercostal space. Earth point, third intercostal space, left of the sternum. Tricuspid, fourth intercostal space, left of the sternum. I'm just going to lift up your breast. And this is the mitral valve, also the point of maximum impulse. And this is where I will check your apical pulse for 1 full minute. And it's 72 and regular. And next I'm going to do it with the bell of my stethoscope, making sure I don't hear any extra murmurs or gallops. Just be relaxed. The aorta, second intercostal space, right of the sternum. Pulmonic, second intercostal space, left of the sternum. Earth point, third intercostal space, left of the sternum. Tricuspid, fourth intercostal space, left of the sternum. And the mitral valve, midclavicular line, fifth intercostal space. And no murmurs or gallops or extra beats was heard. S1 and S2 was oscillated with no problems, and your rate in rhythm is regular. All right, next I'm going to ask you to lie down. All right, and then I would also check, because sometimes doing the heart, it's positional, so I would check the heart with you lying down also, and it would be in the same sequence. let me start back over. Aorta, pulmonic, Erb's point, tricuspid, and mitral. Okay, and also since I've checked your heart sounds, I'm going to go ahead and I'm going to check your arteries. So it'll be your carotid, auscultate, excuse me. And this will be done bilaterally. Okay, and I'm going to do your aorta artery, and I'm going to go to the base of your sternum. Okay, and then also I will check your renal arteries. I'll come down and over. And then here's your umbilical, and this is your iliac. 45 degrees out. And then your femoral, and I will check here for your femoral. Alrighty. And I'm going to raise the height of the bed up 30 to 45 degrees, and I'm going to check for jugular vein distension. And just hold your head straight. And I see no JVD. I'm not sure if I covered, but I'm going to check if her fingernails are painted. But if I was checking for cyanosis, making sure that your oxygen level was fine, I would press down and make sure that your capillary refill was less than 3 seconds. And I would do that in each fingertip, and also I would do the toes. Alrighty, and so now it's your abdomen. Okay, your abdomen on inspection. I see that she has a tattoo, but on that it's smooth, flat. She does have some scarring, but her umbilical cord, not umbilical cord, navel is slightly inverted. And I do not see any lumps or bumps or visualize any masses at this time. But what I am going to do now, I'm going to auscultate. In the lower. Listening for bowel sounds. Normally, I would listen in each quad for 5 minutes to get an accurate bowel sounds. Okay, and do you feel any tenderness or any pain?
No.
Okay, I'm gonna palpate. I'm just gonna do it lightly. And as I palpate, I'm gonna look at her facial expression to make sure she has no facial grimacing or grunting for pain. Now I'm gonna deep palpate. Two to 3 centimeters. Okay, next I'm going to check for organ megaly. I want you to take a deep breath for me. I do not feel the liver. Okay, you can exhale. And next I'm going to check for your spleen. I'm going to lift you up, let you down, Then take a deep breath. And you can exhale. Do not feel the spleen. So she has no organ met. Okay, I'm going to ask you to sit back up. I'll help you. All right. So next we're going to check. Oh, I'm sorry. Oh, you know what? With the hearing, I forgot to do the air conduction. Okay, so with this, first I'm going to check for your acoustic. And I want you to tell me when I put it on your master process, I want you to tell me when you don't hear it. Then I'm going to stick it next to your ear. And I want you to tell me when you don't hear the vibration.
Okay, I don't hear it.
Okay. Can you hear it now?
Mm-hmm.
Okay, let me know when it stops.
It stopped.
Okay. Do the other ear.
I don't hear it.
Okay.
It stopped.
Okay, and so that's normal finding. Your air conduction is greater than your bone conduction. Okay, the next is testing for lateralization. I'm going to put on your forehead, and I want you to tell me if you feel the vibration in both ears at the same time. Do you feel it in both ears?
No. Yes.
Okay.
Yes.
And then the next one is the whisper test. And I'm sorry that. Okay. I want you to cover your right ear, and I'm going to whisper a word, and I want you to tell me what I say.
1, 2, 3.
Okay. Cover this ear.
Red, black, blue.
Okay. So you're hearing auditory is functioning just fine. Okay, so now we're gonna do the push and pull, and I'm testing your musculoskeletal. So whenever I ask you first, I want you to try to raise your shoulders against resistance. Okay. Okay, raise your arms, stretch them out. Okay, raise your arms. Okay, let them lower them down. Okay, put them back like you skiing.
Like my skin.
Yeah. And bring them back toward me. Okay, bring them up towards you, and then push them back down. I want you to lean your head back, lean your head chin to the, I want you to turn your head to this, with the chin to, okay, and then to this side. And I want you to raise this arm over your head. Okay, are you able to touch your scapula, putting it back? Are you able to touch, with this hand, touch your scapula? Okay, and with the other hand, touch your scapula. All right. So now I want you to raise your legs up against resistance. Okay. Now bring them back down. Okay. I want you to bring your legs out. And I want you to, that's backwards. No, bring your legs out. All right, now put them back down. Okay. I want you to click your heels together. Okay, I want you to turn your toes outward, your feet outward, and then bring your feet back in. All right, and then your hands, just put them out. I want you to bring them in. Okay, take them back out. All right, lay your hands flat. I want you to raise them up. Just your hand, your fingers. Your fingers, like she said. Fingers up. Okay, the fingers down. All right, then I want you to wiggle. I want you to take your thumb and press each finger. Okay, and I'm gonna check your vibrations in your wrist. And I want you to tell me when it stop, when you feel it and when it stops. You feel it? You don't? Let me see, I didn't hear it. Maybe. There we go. Do you feel the vibration?
Yes.
Okay, and let me know when it stops.
It stopped.
Okay. Feel the vibration. Let me know when it stops.
Okay.
All right, and I think I don't know if all right, then I'm going to do the light touch on your upper and lower extremities. And I want you to close your eyes and I want you to tell me where you feel the Q-tip touching, such as right arm, left arm, right leg, thigh, or left thigh. Okay.
Left arm. Right arm. Right hand. Left hand. Right leg. Left leg.
Okay, she does have able to identify places, points of touch in upper and lower body. So now with your hands, like you have them resting on your, I want you to turn them over. All right, and then I want you to do just faster. Faster. And I'm checking your coordinations, and she is coordinated. Okay, next I'm going to have you to stand. I want you to come back and face the camera. And I just want you to walk normally with your hands at your side. All right, you can stop and turn around. So now I want you to do heel to toe. There you go. And make sure you keep your balance.
Yeah.
Okay, you can turn around. Okay, next I want you to stand on your tippy toes, stand on your heels, and I want you to try to walk on your tippy toes, and then on your heels. Okay, and I want you to turn back toward me, and this is for pronation, and see if you're able to bring your arms back. I want you to stretch your arms out, okay, and lift them up. Okay, and now drop them back. I want you to bring it back to the same point. And bring them back to the, okay. Oh, and I want you to bend back, just fine, okay. Can you touch your toes? Okay. I want you to turn to, all right, and then the other side. I want you to do the lateral, okay, then on the other side. Okay, and your range of motion, she has perfect range of motion. Do you feel any pain?
No.
Do you have any questions?
No.
Okay, you can have a seat. And today that concludes your head to toe assessment.